Good evening everyone. Today we will discuss another case that is this is a ovarian's endometrial growth, endometrial carcinoma with ovarian growth. Okay, endometrial carcinoma with ovarian left adnexal mass. So in this video I will show you how you will diagnose a endometrial growth inside a uterine cavity and a left adnexal mass. So you can see nicely I have told I will show this video. Be concentrate on this video. Okay. First I will show the uterus. Okay, see here what will happening. You can see here the uterus is there. First is uterus. How will identify it is uterus? Because you can see there is the cervical canal. Okay, this is the cervical canal is there. So cervical canal is there. So after that you can see, I can replay this video. This is your uterus lining. Uterus lining is there. Uterus lining. Okay, uterus lining is there. Then this is your, you can see there will be a thin translucency line, that is this is the cervical canal. Here you can't find any endometrial lining because the endometrial cavity itself is filled with totally by the growth. That is the growth. Okay, so this is the thin line of this is the uterus line, this is the cervical canal. Then now you see how the growth is completely inside the cavity. Growth is completely inside the cavity. Endometrial growth is around 5 into 4 centimeter. It is completely inside the cavity, and you can see there is so many fluid collection inside the cavity also. That may be pyometra, that may be seroma. You can differentiate it because it is a almost clear fluid. Most likely it is because of discharge from this mass or growth. That can be the cause, or it can be a pyometra because if it is a cervical stenosis happen because of the growth, it will obstruct the drainage of the fluid. That will cause a pyometra, infectious content inside the uterine cavity. Okay, so you can see how nicely the uterine growth is there. This total is the uterine growth, and this is the endometrial fluid cavity in the fluid collection inside the cavity. Okay, then next is here right ovary. You can see I will identify the right ovary for you. So you see this is the right ovary. Okay, right ovary is there. Okay, this is the endometrial fluid inside the endometrial cavity. Okay, then you can see this is the uterus. This is the right ovary. Right ovary has a multiple follicle. There is no mass inside the right ovary. Okay, the next thing you will see the left adnexa. You can see this is the fluid. Then you can see there is another mass, solid mass, totally solid, that is more than 70% solid component. This is the solid mass in the dual view. You can see this is the ovarian left adnexal mass. Okay, this is the left ovarian solid mass, more than 70%, 70 to 80% solid component is there. You can see the solid ovarian mass in the adjacent to the uterine wall. It is adherent to the posterior surface of uterus. You can see the left ovarian solid mass is a typically solid component is more than 70 to 80%. Then you call it totally solid ovarian mass. And another things, this is a both endometrial carcinoma, suspected endometrial carcinoma with fluid inside the uterine cavity, and left adnexal mass, solid mass. So you can see I will show this video again and again so you can understand this video nicely. So this is the uterus, and this is the growth inside the uterine cavity. There is the fluid inside the cavity, that can be pyometra or seroma. They nicely seen the cervical canals. Then this is the fluid inside the cavity, can be pyometra, seroma. Then this is your I will show you the left adnexal. You can see some ascites also there. You can see some ascites. This is the ascites fluid in the POD also. Ascites also there. The next thing is here. This is the same things. The growth is the collections. Then this is your right side ovary. There is no adnexal mass. There is some septations is there. There may be of follicles. And the left side, and I will measure. Now I am measuring this ovarian mass size, ovary size. Then this is cavity collections. Now you can go to the opposite side ovary. You can see any adnexal mass. In the dual view you can see there will be a left side adnexal mass with the uterine mass also. You can see how nicely the left ovarian solid mass is visualized. Okay, so basically these are the things you have to see in the ultrasound. So nicely you can understand you can go through the cervical canal first. You have to go through the cervical canal, identify the uterus, then the cavity. There is no endometrial lining because completely growth covering the uterus in uterine cavity, and there is a thinning of myometrium. There is very thin myometrium because gravity, because of strength, stretching because of distension it is almost again infectious content there, so uterine wall serosa myometrium is thinned out, and the red adnexal mass, there will be a ascites. This is a very typical cases, very interesting case. Thank you. If you like this content, please subscribe. Thank you.